Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and today we're going to talk about what vitamins should I take. So I was at the Walgreens the other day and I had a lady I talked to that was perplexed and was staring at her vitamin bottles trying to figure out what she should buy, and I'm going to give you a very simple suggestion on what to do for vitamins. This is not an argument over a specific nutrient preventing a specific disease, but what's the bare basics that you should do. So everybody, in my opinion, should take a multivitamin. A recent study showed that multivitamins don't necessarily prolong health or wellness, but it's a very easy, simple thing to do. Vitamins, I tell people, have 25 different things in it. Everybody's probably deficient in 2 or 3 things. Selenium, zinc, magnesium, anybody's guess is the problem. So you take a multivitamin, you absorb selectively the things that you are deficient in, and your body's pretty good at ignoring what you don't need. The only thing you can do as an a la carte with a vitamin is iron or no iron, and unless there's a specific reason you should not take iron, everybody probably should just take a multivitamin with iron. Your body, again, absorbs the iron it needs. If you have too much iron in your system, unless you're taking a massive amount, your gut ignores the extra iron and it self-regulates. When we look at vitamins from the expensive brand name to the generic, they're almost identical. So go down the line and compare the 2 bottles, and they're almost line by line exactly the same. They're all based on the RDA, the recommended daily allowance for the specific nutrient. And what the RDA is that there are certain vitamins or nutrients that are associated with disease if you have a deficiency. So we'll use vitamin D as an example. So if you have a vitamin D deficiency, you can get rickets. So 400 units of vitamin D is the bare minimum you need to take to not get rickets. So if you take 399 of vitamin D, you might get rickets. If you take 401, you won't get rickets. So that's a very low benchmark to set for a vitamin, but that's the minimum, the RDA. So in addition to your multivitamin, you should take extra vitamin D. Most vitamins have 400 or 800, and it turns out we probably should be taking between 2,000 and 5,000 units of vitamin D. So as a separate supplement, very inexpensive, go out and get yourself some vitamin D between 2,000 and 5,000 units. You can ask your doctor to do a blood level of vitamin D, and almost everyone is horrendously deficient in vitamin D. The last thing that I would recommend is that you take a calcium supplement if you don't have a very large diet or dietary intake of dairy. You want to take about 1,200 milligrams total intake of calcium. If you take it as a supplement, you probably should take calcium citrate like Citracal. That's a much better absorbed calcium than calcium carbonate, which is more common in vitamins because it's inexpensive. 1,200 milligrams of calcium is about this big, so you're never going to find 100% of the RDA in a multivitamin. It would be too big to swallow. So take your multivitamin. Generic is totally fine. Decide iron or no iron. Take your vitamin D between 2,000 and 5,000 units a day and add up how much calcium you're getting in your diet and then the difference you make up with a vitamin. The reason I don't suggest other specific vitamins is that there's a lot of controversy over what vitamins do what, and lots of claims to fame that certain vitamins prevent or treat diseases. And a couple of examples that I use is cinnamon was touted as a cure for diabetes, and it was very popular, so much so that there were multiple medical studies looking at cinnamon and diabetes, and it has 0 effect. So don't take cinnamon for diabetes as an example. Vitamin E was another very, very good example of a vitamin that we noticed that people that had diets rich in vitamin E had less heart disease and stroke. So almonds and seeds and certain healthy oils are rich in vitamin E. So we know that diets rich in vitamin E are healthy for you. So the cardiologist many years ago actually started giving people high dose vitamin E as a supplement, and they actually had either no benefit or actually more heart attack or stroke than if we gave them no supplements. And it turns out in that particular case is that there's 8 different types of vitamin E. The vitamin E that's in your multivitamin, the vitamin E that your liver produces is primarily called alpha tocopherol, and there's 7 other ones. So it may be that it's not that specific version of vitamin E that's beneficial. It's one of of the other ones. And the theory was that I get a little vitamin E in my diet. Whatever version of that is the healthy version, I take extra vitamin E as this alpha tocopherol, and I displace the actual vitamin E in my diet. So I'm actually doing myself a disservice by taking additional vitamin E. So multivitamin, calcium, and vitamin D. You're welcome to put comments below on what you think a specific vitamin does for health. I probably won't answer because there's hundreds of theories and hundreds of vitamins, and there's very little data to support any of these. But those are the bare basics. Obviously, you should be getting a wide variety of fruits and vegetables, getting your vitamins as natural as possible, getting them as fresh and as vine ripe as possible, but all this not always being an absolute option. Take a multivitamin. Dr. Greg Castello, thanks.